I am Nia Maikar, first year MBBS student, Government Medical College, Kozhikode. With immense pleasure, I welcome you all to Dr. House Round 2, conducted by College Union 2022, Government Medical College, Calicut, in association with DOCTUTORIALS. MEDMEET 2.0 is an international UG conference being held at GMC Calicut. It provides opportunities to the budding doctors to showcase their talents and to pass on knowledge. Few of the events organized are case presentation, lectures, digital note making, and a lot more. Out of the lot, we have gathered here for one of the most prestigious events, the Doctor House. The finalists for today's event are Biki Datta, Somya, Kartigeyan, and Shivam Singh. All the best to all of the finalists, and may you be able to perform to your best. Moving on to the program, we have with us Dr. Aditya Gupta, MD Pediatrics, AIMS Delhi, as a quiz master. We are very happy to have you, sir, and I extend my warm welcome to you. Over to you, sir.
Thank you. Thanks a lot, Nia. So I'll start with sharing my presentation, right? And Siddharth will be looking after the Siddharth and Nia will be looking after the points as well. At the end of each question, I'll actually announce give this much points to chest one and the name. So just add the points accordingly, right?
Yes.
You guys can see my screen?
Yes, sir.
Yeah, sure. All right. So the first question is for Shivam. Okay. Oh, sorry, no, sorry. The first question is for chest one. That is your Vicky. And I'll start. All right. Everybody is there. When I finish reading the question, I'll give a 5-second window in which you can message WhatsApp me. You all have my number right now. And after that, I'll stop the 5-second window and then I'll go and ask Vicky the answer. If he answers this correctly, then according to the points I will say. And if you guys have answered correctly, then I'll tell the Siddharth and Nia the exact points that needs to be given. So I'll start right now. So the first question here, Vicky, here is for you. Not a tough question, but here it goes. So you were in your second year of MBBS and there was a psychiatry posting and you met a girl who said to you that she hasn't slept for 2 days and she was talking extremely fast and then literally jumping from one point to another, and you couldn't forget her, like, you know, like she was beautiful, God knows what and whatever it is, but you couldn't forget her and you were like, okay, what she has and everything. Later you formed a diagnosis about her in your own mind, or a professor told you the diagnosis. Now what happened that many years later you're now a pediatrician and now she comes to you and she has a baby, but she came to you because the baby has a problem because the baby had cyanosis. It's a 20-day-old baby and she shows this X-ray. She shows this ECG to you. This is her ECG. So you have to tell me what does the baby have, and why is that baby having this particular thing. 5 points for what does the baby have, and 5 points for why is the baby having this. The pounds window starts now and 5 seconds start now. 5, 4, 3, 2, 1, and pounds window closes. I won't consider marks after that. I'll ask you the question in 5 more seconds, Becky. So Becky, tell me the answer.
Sir, is it abstinence anomaly?
Yes, it's abstinence anomaly. And why is she the child?
Lithium consumption by the mother due to the psychosis.
Due to what?
Lithium, sir.
Okay, let's keep it at lithium. I'll give you 10 points. Not psychosis, it was mania. Okay, so this is a classic case of mania, basically. Okay, and for everyone has gotten 10 points. Everyone answered it correctly, so I'm actually impressed right now. I've seen an anomaly because of the lithium therapy. Everyone answered it correctly. So she was having the incident that I described in the second year MBBS. That was a characteristic of how an acute mania presents, acute mania or hypomania. And we know the drug of choice for mania is lithium. Not for mania, just for the bipolar, basically is lithium. And if she was on lithium for so long and she conceived a baby, lithium is known to cause Epstein anomaly. And the Epstein anomaly has this. If Vicky, you can tell me what this is basically. Hello. Hello.
So
Vicky?
is it WPW?
No, it's not WPW. Fair point. We do have WPW. What will you have in WPW? Can anyone else tell me? See, everyone
Yeah,
has
Himalayan P
Himalayan P waves.
these are Himalayan P waves. So if you can see this, this is the QRS complex and this is the P wave. This is so huge. So it's called the Himalayan peak. It's called the Himalayan. It's the Himalayan P wave basically, which is happening. And why do the Himalayan P waves happen? If someone can tell me.
atrialization of the ventricles.
Fair point. So basically what happens in Epstein anomaly is that there is the leaflets are basically pulled down, and there's atrialization of the ventricles. And when there is atrialization of the ventricles, the P wave basically, which is atrial depolarization, becomes huge. That's what happens in Epstein anomaly. And yes, you are right, Vicky, that Wolff-Parkinson-White also is very, very common. It's around in 50 to 70% of the cases of Epstein anomaly, you will have Wolff-Parkinson-White. But what is characteristic of Wolff-Parkinson-White? Can you see my cursor? Can people see my cursor?
Delta waves.
Yeah, exactly. So in Wolff-Parkinson, you have something called as the delta waves. Q, R, and S that you are seeing, it won't be there. It'll have something like a delta wave. So read about that. So everyone gets 10 points. Everyone has answered it actually correctly. Answer is Epstein anomaly. The child is having Epstein anomaly because of the lithium that the mother consumed because of a mania, not psychosis. But I won't deduct your marks for that. Okay, so it's Epstein anomaly. Now I will move on to chest 2. That is Soumya. So, Soumya, are you ready?
Yes, sir.
Yeah. So, your question is, it's 2 cases and you have to answer correctly. Case 1 is, if people answer mixed match, the reason I put this is because of the similarity. Case 1 is, a child comes to you with growth retardation. He has pancytopenia. He's suspected of aplastic anemia. He has triangular faces, and his X-ray shows that the X-ray that I'm showing you right now. Then there is a case 2. Case 2 is another child with growth retardation, but this child has rickets, he has acidosis, he has proteinuria, he has hypokalemia and hypophosphatemia. So tell me the diagnosis in case 1 and tell me the diagnosis in case 2. I'll be very, very strict with the marking. The 5-second pounce window starts now. Soumya, don't speak right now. The 5-second pounce window starts right now if anyone wants to pounce. 5, 4, 3, 2, 1.
So do we get part points for the penny
Yeah,
single diagnosis?
so I'll be very, very specific as far as the one is concerned. As the pounce is closed, so it's only to Soumya right now. Only 2 people answered. So Shivam answered for the second part. I wanted a very specific answer, like I told you. Shivam, I'll give you an opportunity to modify your answer. Otherwise, I'll give you negative points. And Vicky, you have answered it incorrectly, actually. Okay, so I'll go to chess 2 to get the actual answer, and I'll tell the actual answer as well. So first I'll give negative. I have to give negative 10 to Vicky. And Shivam, I'm waiting. I'll give you 5 more seconds to modify your answer. Otherwise, I'll give you negative as well. Okay, so your answer still is incorrect. Earlier, it was in fact better. I have to give you negative. I have to give you negative 5 for this, Shivam here. Negative 5 for you, Shivam. So negative 5 to Shivam and negative 5 to basically negative 5 to chest 5 and negative 5 to chest 1. I hope, Siddharth, you guys are noting this. So now I'll ask chest number 2 to actually tell the answer if he knows the answer.
Yes, sir. Sir, the first one is Fanconi anemia.
Okay.
And the second one, I think, is Fanconi syndrome.
Very good. Excellent. So this is the answer I expected. So this is the reason I actually put this question and these 2 cases together, that Fanconi anemia and Fanconi syndrome are 2 different things. So Fanconi anemia is what is known as the hypoproliferative, it's one of the hypoproliferated inherent bone marrow failure syndromes. So the child, when I said the pancytopenia component is telling you that it's an inherited bone marrow failure syndrome. It's a differential diagnosis of any child who has aplastic anemia. And in Fanconi anemia, other findings that you have are that the thumb might be absent. You might have absent thumb. You might have absent radii. You are almost there, Vicky. But the thing that the child is having pancytopenia, the child is having triangular facies, growth retardation, all these constellation together makes it Fanconi anemia rather than thrombocytopenia with absent radii. What will happen with thrombocytopenia with absent radii? He won't have pancytopenia. He will have just thrombocytopenia. So this is a classic case of Fanconi anemia. The case 2 is what we know as Fanconi syndrome, which happens in proximal RTA. In which basically we have bicarbonate urea, and along with that we lose a lot of other stuff. Because of the bicarbonate urea, there is acidosis. We lose protein. We lose your phosphate. Because of the loss of rickets, because of loss of potassium, we have hypokalemia. So case 1 is Fanconi anemia and case 2 is Fanconi syndrome. Excellent answer by chest 2. So chest 2 will get plus 10, negative 10 for Vicky, negative 5 for Vicky, and for Shivam also. Both of them get a negative 5, and chest 2 gets a negative plus
Sir, I
10.
have a doubt. Sir, is it a double negative on pounds or just a normal minus
Normal
X?
negative. Actually, I thought that this is too tough a question. That's why I'm in this part. I'm just giving single negative.
Okay, sir.
Okay, this one. Otherwise, it should be double negative. But in this is a very tough question, so I'm giving single negative for this one. So, like I said, Siddhant, I will announce after each and every question that what is going to be the negative and what is going to be the positive. So do mark it correctly. Okay.
Yes.
Now coming to chest 3, that is Karthikeyan, right, Karthikeyan?
Yes, sir.
Yeah. So your question is that to you with repeated episodes of diarrhea, pneumonia, multiple infections, and he has eosinophilia on his blood work, and he has the following rash, and he has been having this since birth, not since 6 months, giving you a clue, not since 12 months, he's having since birth. The pounce window opens for 5 seconds. If anyone has an answer, they can give me the answer. 5, 4, 3, 2, 1. Pounce window, nobody's pouncing. Karthikeyan, do you have an answer for me?
Sir, I actually have a differential diagnosis for this.
There will be no negative. You can go ahead.
Yeah, it could be either Wiskott-Aldrich syndrome, which could have IgE, or it could be some job syndrome also causing like immunodeficiency, hyper IgE, eosinophilia, or it could be eczema is there, so I will go with Wiskott-Aldrich syndrome itself, sir.
All right. So Wiskott-Aldrich can be considered differential. I won't deny that, but the reason why this is not Wiskott-Aldrich is because I did not give you the very, very characteristic third triad of Wiskott. You're actually almost close. I was being very, very honest with you. I initially thought of making a Wiskott-Aldrich question, but I made it a tougher question out of that. So I will not give you any points. I'm so sorry. So what I'm trying to basically tell you is, so you're right, Wiskott-Aldrich will have this sort of rash. Wiskott-Aldrich will have the immunodeficiency, which is being presented in this infant having pneumonia and diarrhea since birth. And this sort of characteristic rash that I told you is called as Omen syndrome. It's a tough question. Don't worry if you don't get it right. But it's a variant of severe combined immunodeficiency, also known as leaky severe combined immunodeficiency. In this leaky severe combined immunodeficiency, the word leaky essentially means that some amount of T cells will actually be present. So they won't really have the lymphopenia that is very characteristic of severe combined immunodeficiency. Some T cells will be there. And what these T cells will do is that these T cells will cause a sort of a graft versus host disease. So your own T cells will actually cause this sort of rash actually, because your actual immune system is 0. So you are not able to protect against yourself your own T cells. And these T cells will actually cause this rash, will actually cause this, sort of rash and sort of a self graft versus host disease. And this is called as Omen syndrome. Tough question. So no issues if any. So nobody gets any point as far as this is concerned. Moving on to question number 4 and chest 5. Here is your question. Are you ready?
Yes, sir.
Shivam, you're ready, right?
Yes, sir.
Yeah. So your question is here. A term baby has Down syndrome and then you realize that he also has thrombocytopenia, very high TLC, anemia. What is the most probable diagnosis? What is the mutation that leads to this condition? 5 points each for the question. The pounce window starts now. 5 seconds start now. 5, 4, 3, 2, 1. Nobody pounced? Okay, so Shivam, I will ask you what is the answer to this question.
Jaundice and distension, thrombocytopenia as well. Is it extrahepatic biliary atresia, sir?
No, extrahepatic biliary atresia is the wrong answer. I'll have to pass it to the next team, just the one for 5. So basically chest 1, you have your shot at this question. What can this be?
Sir, there is negative marking, sir?
No, there's no negative. It's a
Sir, Zellweger.
no, it's not Zellweger. So all right, I don't know how many of you. So a Down syndrome child who has high TLC, I've written high TLC, I've written thrombocytopenia and anemia. This is what is known as a transient, earlier it was known as transient abnormal myelopoiesis. Now it is known as transient leukemia Down syndrome. Very, very characteristic. A Down syndrome child on day 10, day 20 of life will suddenly have this very high TLC, will suddenly have this very high, thrombocytopenia, proper acute leukemia-like picture. It's called transient leukemia because it tends to resolve in a lot of cases. It's caused due to mutations in GATA1. A few of these patients end up progressing to having what is the characteristic when again no negative marks. What is the characteristic AML sub?
M7.
So basically, the M7 will obviously occur at a 1 or 2 year of age, but children like just born Down syndrome children in at day 10, day 5 sometimes can have very high total leukocyte counts, and they usually harbor these GATA1 mutation, and this is called as transient leukemia or Down syndrome. Earlier, it was known as transient abnormal myelopoiesis. The reason it is now called transient leukemia is because it is not a very benign entity. Abnormal myelopoiesis makes it sound like it's a normal entity. It will resolve over a period of time, but it's not. In some cases, it does require treatment. That's why it's called transient leukemia Down syndrome. Now, moving on to question. So this is the end of the first round. The second round, I'll start with the question again will come to Shivam. Okay.
Yes, sir.
Okay, it will be. I'll go in the opposite direction. So, question to you, Shivam, again here is: at 1 year of a child was referred from a hospital to our center in Ames, basically, let's say, with a history of on and off fever, progressive abdominal distension. He had history of recurrent blood transfusion, suggesting anemia. He had hepatosplenomegaly on examination. He had hemoglobin of 9.4. His TLC was very high, 58,000. He had platelet of 32,000, and his absolute monocyte count was 67,000. You did a bone marrow suspecting leukemia, but they were not 20% blasts. They were just 10% blasts and 2% basophils. There was monocytosis, like I told you, present in the peripheral blood smear. And translocation 922 was negative. What is the most likely diagnosis that this child is having? And that's about it. Most likely diagnosis that the child is having. If you can tell me, pounce window is 5 seconds. 5, 4, 3, 2, 1. Soumya, tell me the answer in next. Otherwise, I will have to give you negative marks. All right. So 2 people get it correct. So plus 10 points to Bicky, chest 1, plus 10 points to Soumya, chest 2. And now moving to chest 5. What is your answer?
Sir, juvenile myelomonocytic leukemia, generally seen associated with NF1 as well.
Very good. Excellent. So there are actually 5 mutations it is very commonly seen with. It is KRAS, NRAS, PTPN11, CBL, and the 5th one even I'm forgetting right now. I'll tell you later on. So very good actually. So I'll tell you the concept behind basically this. The purpose is not a quiz. The purpose is to educate you guys as well, right? So what you can see is that this child A has a chronic leukemia. He has this history for 6 months. So first, whenever a child comes to you, child or adult, whenever he comes to you, the duration itself will tell you whether it's a chronic leukemia or an acute leukemia, and the sickness of the person. The person is very sick, acute leukemia. The person is not that sick, he's like otherwise very stable, chronic leukemia. Now this shows that he has some sort of a chronic pattern of leukemia. Now chronic leukemias in children are just of mostly of two types. First is chronic myeloid leukemia. Yes, it can occur in children as well, not just adults. And the other one is juvenile myelomonocytic leukemia. Now, he has all the things that are characteristic of juvenile myelomonocytic leukemia. He has monocytosis, showing an absolute monocyte count of 6,700. Normal monocyte count should be less than 1,000. He does not have acute leukemia. Why? Because the bone marrow showed not 20% blast, which is the definition of acute leukemia. It showed 10% blast. And it is not CML because I characteristically mentioned that translocation 922 was negative. So if you have a child, a 3 to 5 year old child who comes to you with similar presentation, usually they tend to come in 2 to 3 year age group, who has monocytosis on blood smear. If you do the bone marrow, they don't have 20% or 30% blast. They rather have 8, 10, 15% blast. They do not the definition of acute leukemia. Translocation 922 is negative. The most common differential and most likely differential is JMML. I hope you understood the concept. Hello?
Yes, sir.
Yeah, sure. So moving on to the next question. This time it will be from, since I'm starting from chest 5, next will be Kartiken. Kartiken, your direct question here is, mother has polyhydramniosis. She delivers. Soon after the delivery of the child has choking while feeding, excessive bouts of cough. I will give you a chest x-ray. What is the diagnosis? Tell me. The pounce window is 5 seconds. Anyone wants to pounce? 5, 4, 3, 2, 1. Everyone has pounced. 2 people have already answered. 3 people have already answered. Shivam, can you modify your answer a bit? Although I'll give you full points for this. Anyhow, forget it. They all have got an answer correctly. Kartiken, tell me the answer.
Sir, is it esophageal atresia associated with tracheoesophageal fistula?
Yeah, you're absolutely correct. So the reason the mother had polyhydramnios was because he was having esophageal atresia. So the child was not able to, as we know, that the child gulps down the amniotic fluid. So that's why the child is having the polyhydramnios. And soon after birth, they will be choking while feeding because there is esophageal atresia. And this choking while feeding will then further results in excessive bouts of gout. And what is characteristic here is that we have tried to put an NG tube that is curling up in the esophagus. So the answer is here is esophageal atresia. Everyone gets 10 points. Everyone gets 10 points. Siddharth, know that everyone gets 10 points each.
Sir, for the previous question, only 3 of them gets 10 points, right?
Yeah. Only 3 of them gets. Kartiken did not answer it correctly. Or rest 3 answered it correctly.
Okay, sir.
Now moving on to chest 2. Here is the question. This is semi GK based question, so don't be surprised. Let's assume let's assume Selena Gomez has a child, and the child of Selena Gomez, we know the normal heart rate of a newborn is between 100 to 160. But when her child is born, the child's heart rate is between, let's say, 60 or 70. What is the diagnosis? This will require a bit of general knowledge. So pounce window will be 5, 4, 3, 2, 1. 2 people have already answered this. I'm actually surprised that your guys' GK is that good. Great, actually. So 10 points each to Vicky, chest 1, 10 points to Shivam, chest 5. And now I'll open the question to chest 2. Soumya, tell me the answer.
Yes, sir. So this is neonatal lupus presenting with congenital heart blocks.
Very good. Excellent answer. So we know that Selena Gomez has SLE. If I don't know whether other people you know or you just took a guess, Selena Gomez has SLE. And anti-rogue antibodies especially can cause this congenital heart block, which is the reason the child is not having a normal heart rate. Excellent answer. And 3 people have answered it correctly, except Kartiken. Everyone gets 10 points. Siddharth, I hope you're noting down.
Yes, sir.
10 points to everyone except Kartiken, chest 3, that is. Now, the final question to Vicky again. Vicky, you're ready for your question?
Yes, sir.
All right. So you have a term newborn. He within hours of his life, he has marked hyperbilirubinemia, like 30, maybe even 40. Not on day 2, day 3, day 4 of life. On day 1 itself, he has marked hyperbilirubinemia. ALT/AST is 200, 300. PTINR is very deranged. And ferritin specifically is highly elevated. What is the diagnosis? Pounce window starts in 5, 4, 3, 2, 1. Nobody pounds. Great. So, Vicky, the answer is open to you. Tell me what is the diagnosis.
Sir, anything related to Kawasaki?
No, this is not Kawasaki. No one have Kawasaki. Okay. So I'll pass the question to chest 2. Answer.
Sir, is it neonatal hemochromatosis?
Excellent 5 points to Soumya. It is neonatal hemochromatosis. The most likely cause of this neonatal hemochromatosis will be gestational albumin liver disease. So 5 points to Soumya. Excellent answer. So we are done with 2 rounds. I think we will like people will like a scorecard. If Siddharth can tell the scores once. Siddharth,
Yes, sir.
can you tell the score once before we proceed for the next 2 rounds?
Yes, sir. The total score is for chest number 1, it's 35, and for chest number 2, it's 55, and for chest number 3, it's 20, and for chest number 5, it's 35.
So this is just these 2 round scores, right?
Yes, sir. Yes, sir.
Yeah.
Total score of these 2 rounds.
All right, great. So you already know the scores from the previous rounds. In the previous rounds, actually, participant 3, chest 3, Karthikeyan and Shivam were leading with 70 points each. But now I think Karthikeyan, you need to buck up a bit. This was not your favorite. This was not your best of the performances, I guess. But anyhow, so let's move on. We're done with 2 rounds. Now again, I'll start with the one. So let's get it. You ready?
Yes, sir.
Yeah. So I'll tell, like I told you, in this round, which will
Sir,
be,
your voice is buffering.
is my voice clear now?
Yes, sir. Now clear.
Now it's clear. Just 1 second. Let me. 1 second. Yeah. So chest 1, are you ready, right? Vicky, you are ready?
Yes, sir.
Yeah. So here is a question. A child was noticed to have bilateral eyes. He underwent eyes were removed. Parents, he received and that was it. At 14 years of age, he now is with leg pain and difficulty. So that is the diagnosis, early diagnosis, and what now. 5 points each for each part. So starts right now. 5 points for each part. 5, 3, 1. Nobody pounced. Great. Tell me the answer. No negative for you now.
Sir, anything related to some congenital cataract related metabolic disorders?
No, it's
Such
not.
Norris disease, sir.
I'll pass it to chest to Soumya. Answer.
No, sir. Sir, I don't know the diagnosis.
Alright. So that's it. So nothing is not there. So basically, white eye reflex. What are the causes of white eye reflex? Now, obviously, the question is people. There's no really. Anyone can tell me what are the causes of?
So your voice is buffering a lot.
Primary vitreous
There is
retinoblastoma.
some air disturbances.
Is it coming now?
Yes, sir.
Somebody told me the cause. What was the cause?
Retinoblastoma, sir. PHPV.
Yes.
Coats disease.
Yeah. So the
Toxocolor.
so that child initially likely had retinoblastoma. That's why one of his eyes was removed. The other eye was required therapy.
So your voice is not clear, sir.
I'm so sorry.
Osteosarcoma.
Yes, exactly. So since the child is having bilateral retinoblastoma, then if the child has unilateral retinoblastoma, then obviously it can be a genetic or it can be acquired. Bilateral, definitely there is a germline mutation. It is not a somatic mutation that has occurred. If it's a germline RB mutation, then germline RB, the second most common malignancy that they end up having in this, the first peak of osteosarcoma at the 14, 15 years of age is is osteosarcoma. So an RB can have osteosarcoma later on, even if his RB was cured. Retinoblast, especially the bilateral, because they are having the germline mutations. So this answer here would have been RB and OJS. This is a very favorite. This used to at least be, and at some point of time, a very favorite AIMS question. So it just might be repeated. So in case you guys are interested in postgraduate and interested in INI more, this is a very used to be, at least in 2010, 11, 12. This question was repeated 3 times actually, year after year after year. Now, next question to Soumya. Soumya, ready?
Yes, sir.
Yeah. So here is your question. A very easy question. A term baby with the weight of 4.5 kg is born to a mother with gestational diabetes, and he suddenly starts to have seizure at 2 hours of life. What is the diagnosis? Pounds. There are actually two causes actually. Tell me 2 causes. The 2 causes. So 2 people have pounced. One has given 1 cause correctly. I'm waiting for Shivam you to answer the second part correctly. Okay, so I'll give you part points actually. Okay. Soumya, tell the answer.
Sir, they are hypoglycemia-induced seizures.
Hmm.
And also they may be due to electrolyte abnormalities like hypocalcemia, hyponatremia.
Correct. So I'll give you 10 points to Soumya and 10 points to Bicky. Shivam, you have answered me. You have answered correctly. I won't deny that hypoglycemia. You have answered correctly. Delayed delivery. I had not given the history of any delayed delivery, right? The only history you have is of a gestational diabetes mother. That's it. That's about it. And then 2 hours later he starts to have seizure. I have not given you any history of that there is a such a big child. That's why there was shoulder dystocia. That's why there was so I have not given you history of any let's say that there was a difficult delivery, the APGAR scores were poor or something on those lines. So I won't accept hypoxia as an answer in this question, but your hypoglycemia, obviously, I will accept that answer. So in this question, Siddharth, note it down. Chest 2 will get 10 points. Chest 1, that is Vicky, will get 10 points. But chest 5, that is Shivam, will only get 5 points.
Okay, sir. So for the previous question, none of them gets the score, right?
None of them gets the score. Nobody answered anything.
Okay, sir.
So moving on to chest 3, Karthikeyan, your direct question. Are you ready?
Yes, sir.
Yeah, sure. So this now next 6 questions are going to be about new drugs or drugs with sort of semi difficult mechanism of action, fancy drugs, I'll say. So even if you don't know the answer, it's perfectly fine. These are not going to be 90% not going to be asked in your exam, so don't get jo main bol raha hota hu, like you should know basics more, and your guys basics are actually good from the last 10 questions that I've heard. But Karthikeyan, the first question for you here is, this is a drug called as tisangelucel. Okay, if you can see clearly, it says human T cells only for IV infusion. Human T cell for autologous use only for someone named John Doe. What is this tisangelucel? 5 points for that. Like which disease it is used against, that is the first part. 5 points for that, which disease it is used. And second for part, what is the mechanism of action? Pounce window starts now. 5, 4, 3, 2, 1. Karthikeyan, you can answer actually.
Sir, it is CART cell therapy, sir. Tisagenducal. It is directed against CD19 for ALL, sir. BALL.
Excellent. I have to give 10 points to Karthikeyan, to give 10 points to Bicky. I have to give 10 points to Actually, everyone gets 10 points. I'm surprised you guys know this. कैसे पता है यार? ये तो tough. मेरे हिसाब से tough question. How like was it asked somewhere or like
Vandana Puri, sir.
Vanda ma'am? Okay, this is okay. This is not something that is. This is a, to be very honest, this is a DM level. This was asked in my DM entrance. Okay, you guys ideally should not know about this. Anyhow, so this is CAR T cell directed against CD19, used for BALL, sometimes also used for DLBCL. So basically, what happens in CAR therapy, I guess you guys know, you, let's say XYZ person has acute lymphoblastic leukemia. We'll take out the T cells of that. We'll introduce a gene, a specific gene, and so in those T cells, and then those T cells will start to express that T cell receptor that recognizes specifically recognizes CD19. Then again, we'll transfuse these T cells, which are the own T cells of that person, back into that person. Now, these modified T cells that have that T cell receptor against CD19 will recognize those CD19 positive lymphoblasts, that is BLL blast, and kill them. So that's why it is written here, human T cells. That's why this looks like a concentrate, like a plasma, containing plasma or like platelet. That's why it's human T cell for autologous use only, because they have been taken from that same person. That's why autologous use. And the brand name obviously is the Kymria and Tesangelucin, and it is given against. So everyone gets 10 points in this. Everyone gets 10 points. Moving on to chest 5, that is Shivam. Shivam, your direct question, here it is.
Yes.
This is a drug called Risdiplam. It's an oral drug. Name the disease, name the mechanism of action. 5 points each. Pounds window starts now. 5, 4, 3, 2, 1. Pounds closes. Everyone has pounds. Tell me the answers quickly.
Sir, it is used for spinomuscular atrophy.
Stop. Not you. The other pounds I wanted to tell. Just give me a second. Actually, everyone has correctly answered. You also can tell me the answer, Shivam.
It is RNA splicing modifier used for spinomuscular atrophy. SMA1.
Excellent.
Yeah.
So last year in this quiz, they had asked about nusinersen. The second one that is used is Risdiplam. The nusinersen is given intrathecally. Risdiplam is an oral solution. So you're right. It's a RNA splicing modifier, and it is used for spinomuscular atrophy in SMN. What can anyone tell me? What is the third drug? We knew about nusinersen. We know about Risdiplam. Can anyone tell me what is the third drug? There are 3 drugs that are approved for as far as spinomuscular atrophy is concerned.
Some Zol something, no? I forgot the.
Zolgensma is the trade name यार, वो तो नहीं था.
Onasamnogen अभी पर
Zolgensma, it's actually the beta gen. Even I tend to forget that.
But it is Onasamnogen अभी पर
Yeah, onasmonogen, exactly. He was telling the brand name. Actually, sometimes these, especially when these drugs are initially famous, their brand names also work. So that's okay. Excellent. Who told the answer?
Karthikeyan, sir.
Karthikeyan. Excellent, Karthikeyan. Great that you guys know about this. Can you tell me the mechanism also? Karthikeyan, do you know the mechanism?
Sir, no, sir. I know only 3 drugs are approved for SMA. That's it, sir.
Okay, fair point. Okay. So these 2 drugs are modifiers. In that, you actually give the gene through a viral vector, actually. Okay. So the gene actually goes inside some sort of a gene therapy as far as that is concerned. Now, coming on to...
Sir, all of them get 10 points, right?
All of them get 10 points. Everyone answered it correctly. All right. So, yeah. Karthikeyan, your direct question, right?
No, sir. Shivam, sir.
Shivam. Okay, sorry. Shivam.
Sir, it's yours, I guess. Acha, हाँ, okay, it's going in.
If I'm not wrong.
अच्छा वापस से मेरे ना, because वो पीछे से घूम रहा.
Exactly. Sorry. So yeah, Shivam, your direct question.
Sir, I didn't get the drug question, sir.
You didn't get the
Drug wala round question. I'm confused little. Is this separate round for drugs, sir?
You didn't. Yes. You get it. So everyone will get it to you. Make question. हो सकता है कि लोगों को कम मिले.
Sir,
Excuse me.
voice is buffering, sir. Voice is buffering.
Question 10, 12. Yeah. Hello. Yeah. Is it okay now? Hello.
Yes, sir.
Yeah. I told in the beginning, right? I had five questions because I was thinking they were good. Then I realized that it's only Nishi had made 15 questions in the drug. That's why the third round was questions and drug questions. Okay. So not everyone will get in this. But now going back, everyone. Okay.
Okay, sir.
Okay. So this is again, Shivam, your direct question here comes it. So name this drug which is inhibiting HBS polymerization. If you can tell me the name of this particular drug which inhibits HBS polymerization, a new drug. Pounds window starts now. 5, 4, 3, 2, 1. Pounds window closes. Don't tell me the answer. 2 people have pounds. So Karthikeyan gets the full points and gets 10 points, and Soumya gets 10 points. Shivam, tell me the answer.
Sir, it's voxelotor. It came in this year as INI-CT in the May session.
Excellent. So the answer here is voxelotor, and fair point. So now moving on to Karthikeyan. Karthikeyan?
Sir, yes, sir. Yes, sir.
Yeah, this is your question. This is a drug called lumecaftor, ivacaftor. It's an easy question. Tell me the mechanism of action and the disease it is used in. Pounds window starts now. 5, 4, 3, 2, 1. All right. Karthikeyan, tell me the answer.
Sir, this is triple therapy for cystic fibrosis. It acts by increasing the trafficking of the CFTR receptors in the outer membrane, sir.
All right. Everyone gets correct 10 points for this question. Siddharth, everyone got it correct. Everyone who pounds also got it correct. 10 points to everyone.
Yes, sir.
Okay. Now, so basically, this is ivacaftor and lumecaftor, and they are drugs for cystic fibrosis. One drug acts like a chaperone and stabilizes it. Another drug potentiates the whatever CFTR is actually being formed. Now coming to what's the name? Chest 2.
Yes, sir. Soumya.
Soumya, your question here. So this is a drug called as dupilumab. It acts by a dual inhibition. It inhibits interleukin 4 and it inhibits interleukin 13. Name the two diseases it is approved for use in. The pound starts now. 5, 4, 3.
Asthma, eczema.
All right.
Sorry.
So, all right. So, fair point. I'll actually have to give to everyone 10 points to everyone. Great. 10 points to everyone, Siddharth. No, 10 points have been given to everyone. Okay.
Yes, sir. Yes.
Okay. The last question, hematong related question for you, chest 1. There's a drug called as blinatumomab. This blinatumomab is a CD19 monoclonal antibody. Now, but this is not a normal monoclonal antibody. It is a specific type of monoclonal antibodies. What is this characteristic monoclonal antibody that is used in ALL? Pounds window starts now. 5, 4, 3, 2, 1. Nobody is answering. Only Karthikeyan has answered. 10 points to Karthikeyan. Give 10 points to Karthikeyan, and I'll open the question to chest 1.
Second. So it's egg by egg, combining to the CD receptors, cytotoxic effect, CD19 and CD3.
What is
immunotherapy
this?
like?
You give a better answer.
Linking therapy like.
Chalo, I'll give you the marks. Explained it correct. Explained it correctly. 10 points to one, 10 points to Karthik. The answer here it's a bispecific T cell engager. It's called BITE therapy. Like you said, it engages both CD3 and CD19. So it's not a normal monoclonal antibody. At the one end of the monoclonal antibody will engage the tumor cell, CD19, the tumor cell. The other end will engage a T cell, and then that T cell will kill the tumor cell through this bispecific T cell engager. So you gave the concept correct. It's not a linking therapy. It's called BITE therapy or bispecific T cell engager. Karthikeyan had answered it correctly. So 10 points to Karthikeyan, 10 points to Cheswan Babakali. So that's it. That's the end of the quiz. Can we now have the formal scores?
Yes, sir. 1 minute, sir.
I hope you guys enjoyed.
Yes, sir. Awesome quiz, sir.
Thank you. I hope you guys like the concept of pouncing.
Yes, sir. There, like in the TAMS quiz, they have pounds.
They have pounds. Okay. Many quizzes have pounds. Many quizzes don't have pounds. I do not know how to do. The ideal way would have been if you guys could have personally messaged me here in Google Meet itself. It's actually possible in Zoom. It's not possible in Google Meet. So that is an unfortunate thing. But otherwise, fair enough. You guys WhatsApp me. That works equally well.
You opened my eyes to read pediatrics, sir. I've been completely blank. I should finish that SPM subject, throw it away, and read something else. No.
No, don't be in that. All I'll say is, actually, in fact, I'll tell you which questions can actually be asked in the exams, having given the ones. So, Epstein anomaly, definitely. Epstein anomaly, probably not in the form of Epstein anomaly, not probably in the form of the scenario I gave, but they can ask a relatively direct question directly from lithium. Himalayan P waves was asked earlier in 2000s. Nowadays, it is not asked. Fanconi anemia and Fanconi syndrome, frankly, that was the toughest question. Nobody, I'm pretty sure AIMS or even NEET really won't ask such a tough question. Well, either they'll directly ask Fanconi syndrome, but they really won't make you confused between Fanconi anemia and Fanconi syndrome. Omen syndrome also is a tough question. I really don't think so they will ask. Down syndrome, transient leukemia, Down syndrome, GATA1. In fact, I hoped you guys knew the answer. It has been asked. It's a question which has been asked in INI once before. JMML again can be asked, has been asked. Esophageal atresia, you guys knew the answer. So great. Congenital heart block, you guys knew the answer. Great. GALD, only one person knew the answer. I forgot who got the answer correct for GALD, neonatal hemochromatosis. Who got the answer correct for neonatal hemochromatosis?
Yes, sir. I had got the answer.
So that is a excellent answer. It can be asked. That's one thing that you guys can actually read about. Neonatal hemochromatosis and gestational alloimmune disease can definitely be asked. To be very honest, the drugs that I asked, Voxelotor has been asked, and SMN that I'm talking about will be asked. But CART per se is something which they will ask about. They won't give you Tisanglucel, or they won't really give you. They will ask you what CART is basically. So they might ask you, they will give you a picture that is showing how CART works or something. But I really doubt they will actually ask you the specific names of the drugs and whether it is directed against CD99. There are CD22 also. There is other ones. They're used for multiple myeloma. They're used for MS multiple. So disease specific they probably won't ask. But yes, CART as a therapy, what does it entail, can definitely be asked in INI. If you guys are preparing, if it does happen, if next doesn't happen, whenever that happens or whenever doesn't happen. So Siddharth, can you tell us the scores?
Yes, sir, definitely, sir. So for chest number 1, the score is 95. And for chest number 2, the score is 115. And for chest number 3, it's 80. And for chest number 5, it's 90. So the winner is chest number 2.
All right. Congratulations. Chest number 2 would be the winner, right? Yeah.
Yes, sir. Yes, thank you, sir.
So I think pounds normalizes a lot of things. It takes away a lot of you. And congratulations. anyhow, everyone is a winner. You got to the top 4, and all of you give really, really, really good answers. Hopefully, we'll be able to meet physically, and I'll be able to take a physical quiz someday rather than this online version. But I enjoyed it thoroughly. I hope you guys enjoyed it. Thank you, Siddharth. Thank you, Nia, and for hosting me today here. And I apologize that I was not able to do it in the afternoon. I had a family commitment. But yes, we are doing it here at 9:30, so that's also okay.
So what are the cumulative scores, sir? Like including round 1 and round 2?
He told the cumulative score right now, or did he
No,
tell
sir,
you?
that was for this round. That was for this round.
Okay, so this round, okay. You can add them up also?
No, sir. No, that was the score of total rounds. 4
That
rounds.
was 4 rounds, right? But
Yes,
I think
sir.
Karthikeyan answered more. Karthikeyan had 70 in the beginning. This time he must have been having more answers.
Yes,
Correct?
sir. This was only for your round, entire round. The morning session, I don't think they've added the morning session.
Have you
No,
added
sir. No. Sir, no, we haven't added the morning round score, sir. Just this
the
round.
morning round score, right? Can you add the morning rounds? Do you have the morning round score? I have the morning round scores with me.
Sir, we don't have the morning. Okay, sir.
All right. Can you tell me the scores? I'll add it right now. I have the numbers with me, so that really won't be an issue. Can you give me the scores right now?
Yes, sir. Chess number 1, 95.
Just 1 second. Just give me a moment.
Okay, sir. Okay, sir.
Yes, chess number 1 has how much?
95, sir.
So chess number 1, I'll tell you the total score of chess number 1. So 95 and 52. So that will become 147.5 will be the total score of chess number 1. What will be chess number 2's totals? This current score?
So 115, sir.
So 115 plus 62, that will be 177.5 will be the total score for chess number 2. What is participant chess number 3 or participant 3? Karthikeyan's this number scores?
80, sir.
So he will have 150 total. And what is Shivam's total score?
90, sir.
So he will have 160. So winners stay the same actually, despite adding the first one and the second one.
Like I'll come third, sir.
I don't be doing this complicated. It's just a quiz, never even the exam. Thank you to your students union for allowing me to host this quiz. But great, I actually enjoyed it a lot. You guys can obviously connect with me if you guys have any doubts, and I'll be happy to help.
Thank you, sir, for being a part of this session and for explaining things in detail rather than just asking questions. Thank you so much for your time. Thank you. Good night.
Good night.
Thank you, sir.
Thank you.
Good night, sir. Good night.
Thank you, sir.